Hello everyone, it's Jackie and Amy and Maya with True Skin. Today I have the pleasure of doing an IPL, which stands for Intense Pulse Light, treatment on Amy. IPLs are excellent for reds and browns. And when we say that, we mean capillaries, broken capillaries. We can close them up around the nose, the chin, some on the cheeks that we all end up getting for different reasons. And browns. Sunspots, if you call them liver spots, sun freckling, as well as the chest area. And then it does help with fine lines and even skin tone. So today, Amy has a couple things that we want to address when it comes to the browns, as well as the reds. A few capillaries around the nose, which we're going to shoot, and then a couple dark spots that most of us have growing up near the Jersey Shore. So we use the Palomar Max G, an excellent laser, but really one of the best on the market. And when you're working with a really good laser, that allows you to really treat deep and have few, if any, injuries or reactions. So, Am, are you okay now?
Yep.
All right. I like to always start out at the chin area to begin with, but also there's a couple of things here that we're gonna attack, so we're gonna do them first. Pulling tip on her, and just that first shot. You ready?
Yes.
Now, you will talk to some people, and well, you might ask some people how it feels. And to be honest with you, it's more like a rubber band snapping or like little stings.
I should say a sting here.
It's not unbearable, but I'm not gonna lie, it's annoying. What did you say, Dave? Like a little,
Annoying, that's a good word for it.
right? It's irritating.
Yeah.
But hey, pain is beauty, right?
That's right. It's worth it.
Yes, exactly. Especially if you upkeep it. So while I'm treating these areas, I'm going to talk about things we're looking for, or if you are even a good candidate or not. Number one, we look at certain skin tones to see if you're a good candidate, how many treatments the person would need, and so forth. Men and women both. You're also a great candidate if you even some acne. IPL is excellent for acne as well. All right, you ready? And you can also, what's great about this IPL, and when you're using professional-based machines, is that you technically, as soon as this is done, you can put makeup on right after if you wanted to. I always tell my clients I prefer you just let your skin air, let it do its thing, but you absolutely can do that if you need to, which is really great. And we always send you out with a treatment that's already on and with SPF, so you don't have to worry about that. And we do just a very light overlapping, so we make sure we get all those spots. It's very, very normal to have some pink, and that would stick around for a little bit, and even feel warm on the skin for about 30 minutes even after your treatment is done. So that's all very normal. Any questions, Amy? I know you're concentrating on getting lasered, but is there questions?
I usually do breathing
Nice.
during this because
You breathe then.
it does help with the sting.
Yeah.
But,
I've had clients who do like a lot of, like a little mini meditation.
Yeah.
Which makes sense. Contraindications, there's several. And I'll give you the most common ones. There's certain melanin in the skin. There's an amount of melanin in the skin that would make somebody not a candidate. So that's something we would do on a person-to-person basis. Anybody that's on an antibiotic or has just finished an antibiotic within the last 2 weeks. Accutane, don't even come through the door until you're off, and I like it off for about a year. So it's very important as well.
I stopped my retinol a few days ago.
I was just going to say, we also like you to stop retinol and any other serious exfoliants or anti-aging, only because this is hot and we don't want it to react like the sun. You know what I'm saying? Kind of like we don't want to put something sunny, hot on fresh baby skin.
Jack, sometimes we need more than one. I have an age spot above my right eyebrow there
Yep.
that you're going to treat. It was treated a while ago.
Sure. Did it get less?
It is bringing it up more so that it can,
Do its thing.
do its thing.
Yeah.
come out. So,
You're exactly right. And we do have different options. We have sets of 3, and I always encourage people to do that because as the dark spots get lighter, it takes more for the machine to really pinpoint that melanin and hold it long enough to do what it needs to do. So I always tell they don't expire. We also can combine it with another treatment, like fractional, like I'll be doing today, on just certain areas.
how far? I mean, I know, but how far in between the treatments? Usually we spread those out about 4.
Yeah, I like about 3 to 4 weeks, depending on what we're trying to do. If we're trying to repair the skin and you have 3 treatments that you purchased, because when we looked at you, we said this is our suggestion to help you reach your goals, and I want to see you about every 3 to 4 weeks. And the reason being is we just want to keep your skin turning over. You know what I mean? Mm-hmm. Indication, you can't be pregnant. Breastfeeding isn't necessarily a problem at all. It's unless, and that goes for any laser anyway, unless we were treating your areolas for obvious reasons. Right. Just gonna hit. This one looks good though, Amy.
So, yeah.
That little man, we gotta. Yes, minute. Also, you will notice the left side of your face is always going to be more damaged. Amy, do you know why?
Probably because I'm the driver and
You
my
got
car,
it.
right?
You got it. So I do tell people, back in the day, we used to, one of the anti-aging things that we would suggest would be to get tint in your windows. Now, every car has it. Most every newer car has just a bit of tint in that window so that the sun beaming on the side of your face. I'm going to do a little bit of adjustment quick so we can do her nose.
Now, I will say now that Jack has done the whole face, and even without the machine on my face right now, I do feel some stinging.
Got it. Yep.
Aftermath, and that'll cool down as my face cools down.
Yep. And
which will do a cool down treatment. Oh my God.
Exactly. And we do it in between everything when it comes to skincare lasers.
I love the IPL, and if people watching this video go to our social media, there's a few before and after IPLs on there, and my very first IPL before and after results were just amazing. I had a lot of sun damage.
Yeah.
I had never had one before, and it just was, those results were
amazing.
Crazy. Yeah.
And then you start getting kind of addicted.
Sure you do.
Right?
Yeah.
So the nose can be very sensitive. And one thing we're not going to do is try to sugarcoat it. The good news is we're pretty precise. We're good at what we do. So if you can let us just shoot it once or twice, we can hopefully close a specific capillary that we're going for. So on Amy's, there's a little capillaries that she has on the side here. So I have set my machine a little bit different. And we're going to go ahead and just shoot that area. We always want to go around the eyes as well, because we all have like a little discoloration under our eye. That doesn't mean we go all the way up until that water line, but we definitely want to make sure that we lighten that area as well.
When you put the machine on my face and then
don't treat it. Yeah, just kind of get you ready. And also, when you're doing stuff like this to your skin, it also brings collagen up into that area naturally. Just this left side. And again, with capillaries, you have to be very careful because if you push too hard, the capillary goes away and the laser won't be able to find the color.
Really,
Yeah. So it's a very, that's done. And there are some things where we can only go around it so often. So I do tell people that's another reason why I like it to be Amy and everyone who's listening. I would get 3 treatments. They don't expire. Now this is most clients' favorite part.
Oh, yes.
Yep, it's heaven. I remember I said that we can't suffocate them, so I always just want to make sure you pat under the nose, but Amy can get claustrophobic if she thinks about it too much, so I try to.
Just a little bit.
Yeah, I know, it's awful, isn't it? And you'd be surprised. I'm gonna leave this on just for a second and do what I'm doing very gently, just cooling the area with a very cool towel. But when you flip it over, boy, I mean, that one side is warm. This is kind of crazy that it does that, you know?
Oh, really?
Yes. Yes, absolutely. I love to use a fabulous post laser.
No, I'm sorry. Are you going to do a fractional too?
Yes, I
Are we
will.
putting that on before my fractional?
I won't do the post gel on you,
Okay.
but I will cool the area. Like with the roller,
Yeah.
which you'll see next. That looks great, Amy. And so I would suggest Amy, from what I see, I would want to see her in about 2 to 3 weeks again because of the capillaries. When you're dealing with capillaries, you could come in every 2 weeks. But since we do other areas and other things, that's great. All this is going to come up, Amy. I mean, it's done. You're going to feel a little spritz, okay, Amy?
Mm-hmm.
And this is our, people refer to them as an ice roller. This specifically is for medical grade lasers. It's actually designed by NASA. So it's non-porous, so nothing can get like kind of spread around. And it holds the cold. And sometimes that contrast is no joke. Aim, would you agree?
Oh my gosh, it feels amazing.
It doesn't feel so good.
It's
I
cooled
mean,
it down. I mean, imagine having a really bad sunburn.
That's it.
And you put that cold aloe gel
you
on your
got
face
it.
after a bad sunburn, and it's just instant relief. And that's exactly kind of what this feels
Yeah.
like. It feels like you got a bad sunburn, not a bad sunburn. You got a
You got
sunburn.
extra sun. Yeah, a little too much
A little
sun.
too much sun.
And when you hop in the shower, you feel it. You know?
You put that. If you don't
Put
keep your aloe in the
aloe.
fridge, you're missing
Oh,
out.
you need to do it.
You need to do that. It's a life changer.
Amen.
So,
and even our
kind of what this feels like.
my thermal or molecular water as well. I would encourage people too. You can go on Amazon, pay $25, you get these really teeny mini fridges. Excellent for product.
Oh, I never thought about that.
Yeah, excellent.
Yeah.
Yeah, I give them as gifts.
Of course you do.
Mm-hmm. Well, because nobody would think of it, right?
Well, how come I haven't got one of those yet?
Well, just because I get other gifts. How you feeling cool-wise, Abe?
Oh, it feels great.
You do?
Yep, I feel
Like
really
it,
good.
like it. Put this on just to be the final cools. I changed the handpiece. Now, if she wasn't getting the fractional as well, we would then move forward with skincare, and then send you home with your aftercare instructions. Right. Okay, so next we have just done skin prep right after Amy's IPL. Next we're going to be doing fractional. Fractional, excellent for skin texture. If you're talking acne scarring, any scars we do, you know, if someone gets a tummy tuck or fell and hurt themselves, it's excellent for scarring. Melasma, which is a discoloration of the skin, sometimes referred to as pregnancy mask because it's brought on by hormone. And there's a difference there. IPL is for sunspots. Fractional is for melasma. IPL should never be used on melasma. It could make it worse. And so that's why it's very important to go somewhere where they're licensed and professional so that they can look at that area and tell you what you need.
Check why. Because if melasma is a discoloration, and so sunspots, I would assume
Absolutely.
before
And
I
it's
came
right
here
to
that
assume.
IPL would be what you use for melasma.
Correct. So usually with melasma, because it's brought on by hormone, it's also brought on by light. So sunlight and heat. That's exactly what the IPL is. Even when you're training with IPL, they say think of anything like the sun. So for example, you can't be on antibiotics, right? We have to look at different skin tones up and down the Fitzpatrick scale. There's some contraindications there depending. So yeah, if you just look at IPL like sun, that's where you would say, oh, okay, because that's what really brings out melasma in a larger form. And it looks totally different than a sunspot, really, but sometimes it can be confusing.
Right.
And that's why I think it's so important to get it checked. And her skin is nice and dry, which is what we like when we are doing a fractional. Again, we do the fractional 1540, which is on the Palomar machine, which is amazing. If you don't know and you have time on your hands, you can look it up. It is an amazing machine. You can feel my hand touching your facing. Awesome. All right, are you ready? We're going to focus around this eye area. And Amy's had this before, so she is getting treated at a bit of a higher level. And that would go with anyone. We always, in the beginning, people just think they want it all done in one shot. The problem is we can't go over it as many times as we want. That's not safe for your skin. Also, we're also pulling up stuff that's dormant. So going it over a bunch of times doesn't mean it's still dormant. So we're pulling up. That's right.
This feels like a sting.
Yep.
Too.
But I think the light, don't you think the light with IPL just adds to it?
Yeah, that light, even with the beanie glasses on, even with your eyes closed,
it's all
intense.
Another thing I let people know, you will feel like almost, and Andy will start explaining it, but if you've ever had Novocaine where you feel like your mouth is swollen shut, but it's not, that's how your face is going to start feeling. You'll feel all the water, the lymph coming to the surface, which is going to make you a little swollen. You have a little bit of edema, but it's not going to be nearly as much as you think it looks like.
Now you're going to feel like, oh my gosh, I must be so puffy.
Yep.
Or whatever. And then you look in the mirror.
And you're like, wow, that was anticlimactic.
Yeah.
This is also, Amy has some large pores on her forehead. Excellent to shrink those. And then just kind of getting these 11s right between the eyes that we all have. I love to treat around the eyes, around the mouth, and the forehead if someone doesn't want their whole face treated, or if I don't think they need it. Although, that'd be few and far between, because it really is just maintaining your skin tone and texture. Just like we take care of our cars and our roofs and everything else, we've got to take care of our skin, our body, and it's an investment in you. All right, now the lip can be very sensitive, so I try to just go as quick as possible, and that's just going around the lip to help those fine lines and wrinkles around the lip. You're doing great. You really, really are. And again, gang, it's not that it's unbearable. It is just,
it's discomfort.
It's discomfort. And I've never had anyone say they can't handle it. The lip, in my opinion, is the absolute worst.
Because you're moving the machine so quickly too,
it's over when it's, I know.
Yeah. I mean, right now my face is stinging a little bit. But I know it's going to calm down.
And it'll be a lot calmer, like momentarily. So, I do tell people though what they should do when they get home. It's definitely, if you feel warmth at all, a nice cool compress like a washcloth. You don't want anything harsh on the skin after a fractional or a super photo. Because we're turning over your skin. It's like it'll be baby skin, so you just want to be very gentle. And I'm just going to shoot 2 more times on these right here.
can you actually do, just right in here, I have a little bit of a wrinkle coming because of the way I sleep.
Yeah, I was going to say,
My skin
side
kind
or
of folds a
anything.
little
Yep.
bit.
And it is where you sleep because it's really more pronounced on one side than the other. Isn't that funny?
Oh, it's the way I sleep. It's crazy. I have to almost do my makeup differently on my left side. As compared to my
Really?
right. Yeah.
Now that's something that's interesting. I don't know if everyone heard that, but Amy was saying her sleeping patterns have actually caused some skin things that she ends up doing makeup differently sometimes on each side of her face. Right. This is going to feel awesome on her, but not nearly as much as when I get the other. And again, we want to cool her down as much as possible and any client before they leave. Because that's really where the healing starts to take place, which feels amazing. Keep your eyes closed for me. And then this just keeps the skin nice and moist as I'm trying to cool it down. And it's a natural antiseptic as well. And you can keep that in your fridge, which is nice. So if you have something like that at home, I love the La Roche-Posay thermal spring water for sensitive skin. It's a large tin can, so it holds the cold really well. And I would put that in your freezer, even just a spritz in the morning. If you're somebody like me, like I have to wash my face with ice cold water in the morning. And that would be ideal for your makeup. Am, how you feeling at this point? I know you're still warm and maybe, I don't know, still feel like it's like swelling like we talked about?
No, not as much. Like right after everything felt intense, it felt like woo, but the cool down definitely has helped
It's
that.
heavy. And now we add, depending on the skin type, we add different post laser gel, which actually holds the cold. And then we do the best thing in the whole universe, which is, like I talked about, the roller.
God, I love the
And it's heaven. It really is.
I love the roller.
And here we go. Oh. This helps with the laxity. See how, like, as we age, our skin gets more loose? Fractional has one of the excellent things about fractional is that as you're treating, you're smoothing out scarring or really deep lines. It's also, you're producing new collagen because of that. So it really is a no-brainer. And this is why years ago, when we opened, that was our goal, to be able to give just regular working people a chance to take care of their skin just like the rich and famous do. And so we are so blessed with 4,500 clients that really most of them are like family.
For real. Yeah.
Yeah, I mean, just really wonderful clients. We really enjoy what we do.
I do always get sad when a client is like
Done?
done.
Oh, I hate
Their
it.
laser hair removal.
Right.
Like, and I'm like, oh.
We'll see them for skincare, but
yeah,
that's
they'll
not as
come back
often.
eventually.
Yeah.
Or they might be like, don't miss us. And I'm like,
Yes, they do.
what can I get treated next?
Exactly.
But it's just, it's a weird thing at the end. You're like, oh, you're done.
Yeah,
I
totally.
just saw you every 6 weeks for the last couple of, 2 years for laser hair removal. And so, but they always find something else to come back
Oh,
with,
heck
so.
yeah. And a lot of them, if the women are done in about a couple of years, that same little girl that they were bringing in with them because they
Yeah,
had to get their hair removal ends up being a client of ours.
yeah.
It's really interesting to see that. We're very blessed. It'll be 15 years in the fall. Right? 14? 15 in the fall. We're going to have a big party on that. Amy.
Yeah, we are.
So you're going to see me just spritzing again. Then I love to end with the La Roche-Posay Double Repair Face Moisturizer. This has niacinamide in it, which I love. I like all my clients to have a good SPF, and this doesn't have an SPF in it, so I love the Urocin. It's the new Age Defense. It's 50 for the face stain, but it has hyaluronic acid in now. It's brand new. And I've loved all their stuff, but this is definitely one of my favorites now.
So, Jack, when can I go back to my regular skincare routine with retinol after a treatment like this?
Yeah, I'd like you to wait a little bit, to be honest with you. First off, I tell everyone, I don't want you wearing makeup for 24 hours.
Because I had the fractional.
You got it.
Okay.
But with fractional and IPL, I don't want you involved in any heat, meaning no saunas, no hot tubs, no overheating yourself. So that's
Hot showers.
no hot showers with the water running down your face. And then retinol, it's different for everybody, but I do tell people, give it a week. Let your skin start. But then the problem is when I say that, if I'm going to see you in 2 weeks anyway, while you're under our care, until we say, okay, you're done with your treatments, I would lay off retinol.
Okay.
You know what I'm saying? Because I'm only going to see, then, we like you to be off. And again, we want you off if you think about being in the sun, right? You wouldn't walk around the beach in July with your face bare to the sun,
Right.
if you've used retinol. So, or any other type of anti-aging exfoliant. I like to use the cooler roller, just to push in, but also, it feels good. And also cool, that's why when they say to rinse, they say lukewarm or cool water, it closes your pores. So now you have the product in, it's locked in there, and from here on out, our skin does really the rest of the work until I see her again in about 2 to 3 weeks. And we customize all our packages, but if you're looking at an IPL or possibly a SuperPhoto, that can range anywhere from about $250 to $400, depending on how much of one we're going to use or what type of treatment we use also in conjunction with it. But that gives you kind of an idea there. And we are done.
All right.
Thanks so much for hanging, guys.